Dogba, and I'll be sharing my screen with everyone right now. I won't take too much of your time, and I'm just here to talk about panic attack, but just a little about me and what medicine actually means to me. So, my name is Dr. Ladogba. Like I said before, I'm from Nigeria, and we are called the Giant of Africa. So I'm still very proud of that till anytime. And I belong to a tribe called the Yoruba in Nigeria. So I actually graduated in Nigeria from the University, Canada University, Okada in Edo State, and I'm actually a family physician. So generally, medicine to me is a noble profession. It's all about healing and care. So I went ahead and I checked the statistics of how people actually recognize what doctors do, and I found out that more than 83% of the world population actually recognize that the role of medicine is quite enormous. And I'm quite happy today that we're here to discuss and also learn from one another. And the best experience I actually had in medical school was that, you read stuffs in books and you just go to the world and you see them happening. I don't think there's any other feeling that actually beats that. But some of the most difficult experience I had was I had to learn a lot of stuffs and also retaining them. So it takes me a lot. It's actually took a lot of practice that I have to read stuff over and over again. So and just the piece of advice I have: just be diligent, and trust me, it will take you very far in the medical field. A lot of us actually enter into medical school because we're actually from the best from different schools we're coming from, and we have that kind of belief that we're actually the best. But mind you, this is just a group of best people from different regions competing for the same thing. So you have to be diligent. When the teachers or your lecturer say you should do A, don't believe that it is C. If you have any doubt, you should ask questions because along the way, not to scare you, you will see those who are very, very obedient and they may have challenges along the way. So I'll be talking about panic attack, and you can see here in the picture here that this lady holding a chest. And I'm not going to take too much of your time. I'm just going to tell you a story, and from that story, I believe you can take one or two things home. I'm trying as much as possible not to also talk about a lot of things that wouldn't make sense to you guys. I'm sorry if this is a little bit crowded, but I just want to talk about how you're going to identify panic attack and what do you do in case of panic attack. So just imagine that you have a friend and your friend's name is Jane Doe. And you guys are just in the room reading together one day, and all of a sudden, she just actually held her chest the same way this lady is doing right now, and she feels that she can't breathe, so she has shortness of breath. I actually picked a mnemonic from which is what you'll be using so well in medical school. That is one of the ways we learn. We try to use codes. We call them mnemonics. So it is called the students fear three C's. So this person may have this shortness of breath that they have difficulty with breathing. They are holding their chest and they're actually shaking. They're trembling. The person is not stable, and the person may feel that the things around are not real, or she's actually looking at herself from outside, or the person may have some fears. And if you remember, and the person have fear of dying, or they are going to lose control, or they're going crazy. And all this is just like deja vu. It happens like 5 to 10 minutes, and the person is fine. So if you are beside this person, or if this happened to you, what do? You just have to call for help. So, which is what is going to make you a good doctor. A good doctor, if you're able to identify your limit and also you know the best thing to do at any particular point in time. So, if you know anyone, just tell the person you call for help and let the person know what panic attack is because it could be scary. It could seem like it's a heart attack, but if the person just have this reassurance that this is just a phase and it's going to pass. So, we also encourage people to keep track. When does this happen? Where does it happen? And how long does it actually last for? And just tell them just breathe. And it's just the anxiety and it's going to pass. So if this doesn't work most times, we go ahead and we refer to specialists, and they do some therapies, which is more about the lifestyle modifications. And I won't want to bore you about the name of drugs or the name of steps we take. However, there are some therapies they do. First, we don't just jump and rush to medications. And when they use this therapy, if it works, fine. If it doesn't work, then they go ahead and use medications. So, and I hope with this, you in future, if you see someone actually having difficulty with breathing, they're shaking, they're sweating, they feel like choking, they feel like they're going crazy or they could lose control, then you should be thinking of something about panic attack. And it's very, very common. So I don't want to take too much of time today, but I want to thank everyone for listening to me. And do enjoy the rest of your day. And I wish you guys the best of luck.
Thank you so much, Doctor. Okay, so we go to the next presentation.
Hello, I'm Dr. Tasneem Islam. Let me quickly share my screen. Sorry for my broken voice.
It's okay, it's pretty.
Thank you. Can you see my screen, Doctor?
Yes.
So, yeah, this one. So I'm Dr. Tasneem Islam, and I came from Bangladesh. I practiced as general practitioner there for 2 years, and then I came here, and I will be applying for CRAMS to 2023 this year for family medicine. So like I have a lot of experience there because I was doctor in a developing country and I worked in a rural hospital. There are so many stories to share, but I will share one story. Since I'm presenting shoulder dislocation in sports, so one story came in my mind was like one day there was a fight in nearby village and there were influx of like 30 to 35 people, all were injured. I know it's a sad story, but it was a great opportunity for us to learn all the stitches and sutures. It was overwhelming. I can still remember that I gave stitches 3 people, and one stitches were extending from the neck to the lower back. I had to stitch the muscle and skin, and we like as an intern we had to do everything because there were so many pressures of patients, you know. Anyway, I remember that one. And piece of advice, of course, I feel like what I did not do, like ask a lot of questions to everyone, whomever you meet, your teacher, residents, and everyone. So ask and ask. Don't think like it would be a dumb question, because the more you ask, the more you will learn. And be empathetic. Empathy is something that make you stand out from others. So I'll be presenting shoulder dislocation sports. I will not take a lot of time because there are other doctors. So shoulder dislocation, what is it? So I will show you the anatomy a little bit. This is humerus and this is scapula, and the joint is called shoulder joint. And shoulder dislocations refers to separation of this joint, humerus from the scapula at this joint. And the shoulder is held securely by the ligament, capsules, muscles, everything. And whenever these structures are weak or injured, shoulder instability or dislocation can occur. And this joint has a large range of motion. That's why it is less stable than other joint, making it more commonly dislocated, especially in sports. So what kind of shoulder dislocation may happen? There are 3 kinds of shoulder dislocation. Anterior one is like when the humerus goes um, you know, front and it happens after fall onto outstretched hand. And posterior one is like when the joint goes backwards, and it usually happens after trauma or seizures. And the inferior one, that the joint goes downwards, is happens after high energy injuries. So what's the management? So like as I'm talking about shoulder dislocation in sports, so if a medical professional is present when it happens at the field, you know, they may be able to put it back in place while at the field before the muscle starts to spasm. Otherwise, usually it is necessary to repair it at the emergency room. So we have to provide adequate painkiller, and a specialist needs to examine the injury, maybe do a physical exam and sometimes imaging to find out the extent of injury. And they have to also check full neurological and vascular assessment before doing any maneuver. And about recovery, like for less severe dislocation, usually adequate rest and physical therapy and painkiller is enough. But for severe dislocation with more damage, surgery is frequently the best option. On average, like players, they can return to non-contact sports after 5 to 6 months if they go for non-contact sports. But for contact sports like basketball or soccer, they need to wait at least 6 to 9 months, depending on the extent of the injury. And I can recall so many injuries in players, but I just included two. I remember Mohamed Salah in 2018 Champion League, and Jack Collins, like the basketball player in 2019, they had severe shoulder injury while at the sports. I hope you enjoyed it. Best of luck to all of you.
Excellent. Thank you, doctor.